State of Cannabis.
This is the State of Cannabis News Digest, a roundup of this week's key developments in the cannabis industry. Our top stories.
Today, cannabis policy in the United States is being pulled in sharply different directions. In Washington, a group of Massachusetts businesses is asking the U.S. Supreme Court to rein in federal power over state legal marijuana, even as Medicare considers paying for certain CBD products for the first time. Together, those moves could redraw the legal and medical boundaries of cannabis at the national level. On the ground, the politics are no less fraught. In Florida, a technical dispute over petition forms has put hundreds of thousands of signatures at risk in a 2026 legalization push, while in Massachusetts, a new ballot measure could roll back much of the state's existing recreational market amid accusations that voters were misled. And beyond the ballot box, the economics are shifting. Michigan faces a constitutional fight over a new wholesale tax on cannabis. Ohio is weighing whether to treat out-of-state marijuana as contraband, Minnesota is experimenting with city-owned dispensaries, and Tennessee is steering its hemp THC industry toward an extended but likely permanent wind down. All of that coming up. Stay with us for the full story behind each of these fights and what they may mean for the future of legal cannabis in America.
And now here is the deeper look at the key events in the cannabis world this week.
For the first time in decades, the Supreme Court may be forced to reconsider whether the federal government even has the authority to regulate marijuana that never crosses state lines. A group of Massachusetts cannabis companies has asked the justices to hear their case, arguing that the Federal Controlled Substances Act should not apply to state-licensed marijuana businesses whose products never cross state lines. The Libertarian Cato Institute has filed a brief backing them, saying federal prohibition has swallowed up states' rights to set their own cannabis policies. Lower courts have rejected that argument based on earlier Supreme Court precedent, but Justice Clarence Thomas has already hinted that it might be time to rethink that approach. If the court decides to hear the case and eventually sides with the companies, it could give legal cannabis markets in places like New York, New Jersey, D.C., Maryland, and Virginia more protection from federal interference. And while that question plays out in the courts, Washington is also quietly rethinking cannabis inside its largest health program.
For the first time, Medicare is officially taking a serious look at covering CBD. Right now, federal Medicare rules treat cannabis and CBD as a single category and exclude them both from coverage. But that could change under a massive proposed rule governing the 2027 Medicare Advantage and prescription drug plans. In that document, the Centers for Medicare and Medicaid Services says it wants to narrow the exclusion so that only cannabis products that are illegal under state or federal law remain blocked. Hemp and hemp-derived CBD that meet the legal definition of hemp and follow FDA rules would no longer be automatically excluded. CMS is also proposing a real-world pilot program that would pay for CBD in specific clinical settings. The agency says it wants to focus on FDA-regulated or pharmaceutical-grade products so that doctors can rely on known dosing and purity. The pilot could begin in 2027, potentially in areas such as oncology and palliative care, and would track safety, dosing patterns, and patient outcomes inside the Medicare system itself. The agency frames this as part of a larger public health problem. Seniors use large amounts of pain medication, and opioids carry serious risks. CBD is already being used by many older adults as a non-opioid option, but they are paying out of pocket. CMS says it wants real Medicare data instead of relying on outside studies and anecdotal evidence. The timing has drawn attention. Just weeks before the proposal surfaced, Health and Human Services Secretary Robert F. Kennedy Jr. met with a CBD advocacy group whose video urging Medicare coverage of CBD was later shared by former President Donald Trump on social media. Even if the rule moves forward, coverage would be narrow at first. Only products that meet both federal and state rules would qualify, meaning a small group of tightly regulated CBD products would likely be used in the pilot. CMS is accepting public comments until January 26, 2026. If the proposal is finalized, the CBD pilot and the new cannabis language would begin with the 2027 plan year. While Washington studies whether CBD belongs in mainstream healthcare, states are still fighting over a much more basic question: who even gets to vote on marijuana in the first place?
Florida's long-running fight to legalize recreational marijuana took a sharp detour in a Leon County courtroom, and then quickly pivoted back into a high-stakes administrative battle. The setback came when Circuit Judge John Cooper upheld the state's decision to throw out more than 200,000 voter signatures submitted by Smart and Safe Florida, the group leading the 2026 legalization effort. Those signatures, nearly one-third of what the campaign had collected at the time, were rejected because the petition forms included a web link on the back where voters could read the full text of the proposed constitutional amendment. State lawyers argued that this made the forms unapproved under Florida law. The campaign called the change minor and said it acted in good faith, especially since many of those signatures were collected before a newer law required the full amendment text to appear directly on the form. But Judge Cooper ruled that the statute left little room for interpretation. Signatures collected on an unapproved form simply cannot be counted. At first, the ruling appeared devastating. A February deadline was looming, and the campaign still faced a massive signature requirement. The political stakes were already high. Polling shows strong bipartisan support for legalization, yet Governor Ron DeSantis has repeatedly predicted the measure will face legal trouble at the Florida Supreme Court. Then, just weeks after the court loss, the momentum shifted. Smart and Safe. Florida announced it had now collected more than 1 million total signatures. Enough, the campaign says, to comfortably clear the roughly 880,000 valid signatures required, even after losing the 200,000 that were tossed out. With that cushion in place, the group made a surprising move. It dropped plans to appeal the court ruling and redirected all of its energy toward verification. That is now the real choke point. State officials previously paused the signature checking process for several months, creating a serious backlog. Thousands of submitted petitions remain unverified, and the campaign is pressing the Secretary of State to restart processing and update the public tracking system. Until that happens, the 1 million signature milestone remains largely theoretical. Florida has been here before. The same campaign's 2024 legalization effort won a simple majority but failed to reach the 60% required to amend the state constitution. The revised 2026 proposal includes new language, such as banning smoking or vaping marijuana in public places, designed to broaden its appeal. The campaign is also heavily funded, reporting more than $25 million in donations, most of it from Trulieve, one of Florida's largest medical marijuana operators. For now, the fate of legalization no longer rests with a judge. It rests with clerks, databases, and verification backlogs, the slow machinery that now stands between voters and the 2026 ballot. And Florida's ballot fight is not the only one unfolding. In Massachusetts, the question isn't whether marijuana should expand. It's whether voters were misled into possibly undoing legalization altogether.
Massachusetts, one of the nation's early adopters of legal recreational marijuana, is now facing a ballot push that could dismantle large parts of the system voters created. A group called the Coalition for a Healthy Massachusetts is backing a proposal called the Act to Restore a Sensible Marijuana Policy. The measure preserves some limited reforms, including allowing adults 21 and older to possess up to 1 ounce of cannabis and to gift marijuana to other adults. Possessing between 1 and 2 ounces would no longer be criminal, but instead punished with a $100 civil fine. But everything beyond that changes. Commercial recreational cannabis stores would be shut down. Adult home cultivation would be banned. The legal adult use market that has generated more than $8 billion in sales and nearly $2 billion in state and local tax revenue since 2018 would be effectively dismantled. Only the medical marijuana system would remain. The coalition says it has gathered enough signatures to proceed and credits what it calls honest messaging by professional signature gatherers. But the cannabis industry tells a very different story. The Massachusetts Cannabis Business Association says it is hearing widespread complaints from residents who believe they were misled into signing. Voters in multiple cities and towns report being told the petitions were about preventing youth arrests, affordable housing, or same-day voter registration. Some say petitioners were stationed at tables labeled with those unrelated causes while asking for signatures on the cannabis rollback. Because of these reports, the industry group is urging anyone who believes they were misled to contact their town or city clerk and request that their signature on petitions labeled 1D or 1E not be certified. Both the Attorney General's office and the Secretary of State have confirmed they are receiving concerns. The Attorney General has reminded residents to read the official summary at the top of every petition before signing. Local clerks are now in the middle of certification. The campaign needs at least 74,574 valid signatures to move forward, with strict limits on how many can come from any one county. Certified totals must be submitted by December 3rd. If the measure survives that process, it goes to the legislature. If lawmakers refuse to adopt it, supporters would then have to gather a second round of signatures to send it to voters in 2026. If the proposal ultimately passes, Massachusetts would keep limited possession but erase its adult use retail system, reshaping access, employment, and tax revenue across the entire cannabis economy. As Massachusetts wrestles with whether legalization should even continue, Michigan is locked in a separate battle over how much legalized marijuana should be taxed, and who has the authority to raise that tax.
Michigan's legal marijuana industry is booming, but a new tax may fundamentally reshape how cannabis is priced and who survives in the market. As part of a major road funding and budget deal, lawmakers approved a 24% wholesale excise tax on cannabis products. That tax would be layered on top of the existing 10% retail excise tax that voters approved in 2018 under the Michigan Regulation and Taxation of Marijuana Act. State fiscal analysts estimate the wholesale tax could generate roughly $420 million a year to support a long-term $1.9 billion road repair plan. It is scheduled to take effect January 1, 2026. The Michigan Cannabis Industry Association has now taken the fight to court. The group argues that the state constitution requires either another vote of the people or a 3/4 supermajority in the legislature to change a voter-approved law. By adding a cannabis-specific wholesale tax through a simple majority budget vote, they say the legislature illegally rewrote the rules. The industry also warns of real-world consequences. Retailers already operating on thin margins would see their costs rise and would likely pass those increases on to consumers. A Senate fiscal agency estimate predicts the higher taxes could reduce legal cannabis sales by about 14% and push some consumers back into the illegal market. The state, represented by the Attorney General's office, disputes both claims. It argues that the original 10% tax applies only to retail sales, while the new levy targets wholesale transactions and therefore does not technically amend the voter-approved law. The statute itself says the 10% tax applies in addition to all other taxes, which the state interprets as permission for lawmakers to impose more. Officials also point to Michigan's aging infrastructure and the need to fund road repairs for more than 10 million residents. Judge Seema Patel heard arguments in Detroit and focused heavily on whether the 2018 law should be treated as the exclusive framework for taxing cannabis. She has not yet decided whether to temporarily block the tax, but is expected to rule soon. For cannabis businesses, especially smaller operators, Her decision could determine whether 2026 brings a dramatic increase in financial pressure. For consumers and patients, it could mean higher prices at the counter and a renewed competitive edge for the illicit market. While Michigan debates how heavily cannabis should be taxed, Ohio is taking a different approach. Lawmakers there are deciding whether marijuana purchased across state lines should suddenly become contraband.
In Ohio's post-legalization landscape, the next major fight is not about whether marijuana should be legal, but about where it is allowed to come from. After voters approved adult-use marijuana in 2023, many Ohio residents continued a long-standing habit. They drove into Michigan, where the recreational market is older and prices are lower, bought cannabis at licensed dispensaries, and brought those products back home. Under current Ohio law, that behavior is legal as long as possession limits are followed. Senate Bill 56 would change that entirely. The bill states that only marijuana grown, processed, tested, and sold under Ohio's own marijuana control law, or grown legally at home, may be possessed in the state. An analysis by the Legislative Service Commission makes the impact clear. Marijuana purchased legally in another state is legal today, but would become contraband the moment it crosses back into Ohio. This provision is just one part of a broader overhaul. SB 56 would create a new division of marijuana control inside the Department of Commerce to oversee both medical and adult-use markets. It establishes licensing systems for cultivators, processors, dispensaries, and labs, along with distance rules from schools and churches, license caps, and some priority for disadvantaged applicants. The bill also imposes a 10% tax on adult-use sales and directs revenue to both the state and local governments. The legislation also targets intoxicating hemp products, treating them more like marijuana while temporarily carving out an exception that allows THC beverages to remain on shelves during the transition. It even includes expungement and equity provisions for people with past marijuana convictions and minority-owned businesses entering the market. The border town impact could be immediate. Michigan dispensaries in places like Adrian, Morenci, and Niles rely heavily on Ohio customers drawn by lower prices and wider selections. If Ohio begins treating those purchases as illegal, that traffic could slow sharply. Ohio consumers, meanwhile, would be pushed toward in-state dispensaries and home cultivation, and would have to care not only how much cannabis they possess, but exactly where it came from. A conference committee agreed to a report on SB 56 in November, placing the bill near the end of the legislative process. If it becomes law, Ohio would be among the first states to explicitly criminalize out-of-state marijuana, hardening borders inside the nation's patchwork of legalization. While Ohio tightens its market boundaries, Minnesota is heading in the opposite direction by letting cities themselves become cannabis retailers.
Minnesota is quietly testing a cannabis model that few places in the country have ever tried: city-owned marijuana stores. In Osseo, city leaders have approved plans to convert a 7,480 square foot brick building that once housed the local newspaper into a municipally owned dispensary. The city will hold the state cannabis license and collect any profits. A private Minnesota-based company, Voyager Cannabis Services, will manage daily operations, staffing, training, compliance, and inventory, so the shop stays within state rules. Osseo officials say the goal is simple. Instead of raising property taxes, they hope cannabis revenue can fund visible local needs like park maintenance, firefighting equipment, and road repairs. About 30 miles away in Anoka, a similar plan is taking shape. The city broke ground in May on the Anoka Cannabis Company, a city-owned dispensary being built alongside the municipal liquor store on East River Road. If construction stays on schedule, it could open by December 2025 and become the first non-tribal municipal cannabis dispensary in the United States. Minnesota's adult use regulations explicitly allow this public option, but also limit it. Cities may own and operate dispensaries, but they cannot block private businesses. State rules require at least one privately owned license for every 12,500 residents. Osseo has already done that by approving a license for a private store called Ra's Chunks, which will operate alongside the city shop. There are reasons for both optimism and caution. Minnesota has decades of experience running municipal liquor stores, but the only recent example of a government-owned cannabis shop in the continental U.S., the Cannabis Corner in North Bonneville, Washington, struggled with competition, banking issues, and regulatory costs before eventually shutting down. For consumers, the impact may simply be more choice. For private cannabis businesses, the arrival of government-run competitors raises serious questions about pricing, market share, and long-term competition. As Minnesota's city-owned shops move toward opening, they will serve as real-world tests of whether municipal cannabis can generate steady public revenue without repeating past financial pitfalls. While some states experiment with government ownership, Tennessee is heading toward a very different outcome: the slow dismantling of much of its hemp THC market.
Tennessee's hemp THC industry is not ending with a bang, but with a controlled 18-month wind down. Lawmakers passed a bill this year that bans most hemp-derived THC products starting January 1, 2026. The law targets THCA, which converts into delta-9 THC when heated, and the synthetic cannabinoid THCP. It bans smokable and vaporizable hemp THC products, including THCA flower and vape cartridges. The law also transfers regulation of hemp products and beverages from the Department of Agriculture to the Tennessee Alcoholic Beverage Commission and establishes a new regulatory structure focused on THC edibles and drinks, overseen more like alcohol. Hemp businesses warned lawmakers the ban would devastate the industry. Industry Representative Clint Palmer testified that roughly 75% of the current market, including its most profitable products, would become illegal. Some businesses, he said, invested heavily to comply with earlier state regulations and now face possible collapse. During one legislative hearing, Senator Richard Briggs even suggested Tennessee should consider legalizing recreational marijuana instead of wiping out the hemp market. Rather than repeal the law, the state negotiated a delay. The Tennessee Healthy Alternatives Association reached an agreement with the Departments of Agriculture and Revenue. Under that deal, businesses that receive hemp licenses before December 31, 2025, may continue operating under the 2023 rules until their licenses expire on June 30, 2026. During that grace period, they may continue selling products that would otherwise be banned. In exchange, the association agreed to drop its lawsuit against the state. That gives existing retailers time to clear inventory or shift toward edible and beverage products. But the underlying bans remain intact. There is also a federal clock ticking. A federal spending bill signed by President Donald Trump includes a provision declaring hemp-derived THC products illegal nationwide beginning November 12, 2026. If that takes effect, even Tennessee's narrowed market could face renewed pressure. For consumers, especially those who rely on THCA flower or hemp-derived vapes, the next year and a half likely means shrinking selection and growing uncertainty. For business owners, the mix of state bans, temporary relief, and looming federal prohibition makes long-term planning extraordinarily difficult. By 2027, Tennessee's hemp THC landscape may look nothing like it does today.
This was the State of Cannabis News Digest, available weekly. You can listen to us on all main podcast platforms. To make sure you don't miss out on the latest updates and in-depth analysis of the cannabis industry, be sure to subscribe to our podcast. By subscribing, you'll get notifications for each new episode, helping you stay informed and ahead in the ever-evolving cannabis market. Join us next Saturday for more insights. Until then, keep thriving and stay green.